Some patients will go home on the same day of surgery. Other patients will be admitted to the hospital after surgery. For patients admitted, you'll be our guest for a little while after your surgery. The main goal of your stay is to get a solid start on your recovery. Once you're eating and drinking without difficulty, we'll stop your IV fluids. If you have a urinary catheter, we'll remove it in the morning. Your incisional drain will also be removed, and you'll begin physical therapy to help you regain mobility. Be sure to wear comfortable clothing and non-skid shoes. Your goal will be to get up to a chair 6 times a day. Just like surgery day, keep talking with your nurses about pain control. They'll be checking in with you regarding that pain scale. You'll get a visit from our care management team, who will discuss your needs after discharge, making sure that you have the proper tools at home to continue to recover once it's time to leave. Day 2 after surgery includes even more progress. You'll become familiar with at-home exercises, using a walker or crutches, and putting weight back on your surgical side. We'll also start getting you ready for regular daily living activities as well. We'll review your progress each day to determine when you're ready to go home. Then, your case manager will assist you and your care team with your discharge plan. This includes medications, exercises, and scheduling a follow-up appointment with your surgeon. During this time, be sure to ask as many questions as you need. Welcome home! We're sure you're glad to be back in your own home after surgery. However, just because you left the hospital doesn't mean that your recovery is complete. There are still some important things for you to remember to do while your body is healing. You'll want to skip baths and only take showers to ensure that the incision site isn't submerged in water for too long. Next, eat a balanced diet with plenty of healthy vegetables. Continue your physical therapy, those exercises we went over with you at the hospital. And while less than 2% of patients develop a surgical site infection, please call your doctor right away if you have any of the following signs of an infection. Running a fever. Your incision has yellow or bloody drainage, foul odor, or becomes red or warm to touch. You experience increased pain. Your heart rate increases without exercising. You have a sudden loss of appetite. Getting used to your new joint will take some time. Your pain will diminish, but don't expect to regain full range of motion immediately. Keep your exercise level to low-impact activities such as recreational walking, light hiking, and normal stair climbing. Avoid things like running, jogging, contact sports, high-impact aerobics, skiing, tennis, or lifting more than 50 pounds. Additionally, be sure to take good care of you, not just your new joint. So tell your dentist you have a new joint before any procedures, as you will need antibiotics before you have the procedure to avoid any infection. And take precautions to prevent getting sick. Don't share eating utensils, towels, or linens. Wash your hands, and
get a flu and COVID-19 vaccination.
Remember, we're with you every step of the way. Your success is very important to us, so please let us know if there is anything we can do to provide you with an excellent patient experience before, during, and after surgery. Thank you from the team at Barnes Jewish St. Peter's and Progress West Hospitals.